So welcome to today's webinar on illness management and recovery. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC, housed at Rutgers, the School of Health Professions, Department of Psychiatric Rehabilitation. My name is Katy Rivera, and I'm the project coordinator of the center and will be facilitating your webinar today. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC Network website for additional information at mhttcnetwork.org. We also have an email listserv, and we would appreciate you following this link and subscribing to receive notices about our upcoming activities. Before we begin the webinar, I wanted to quickly review some housekeeping items. Today's webinar is part of a series on recovery from serious mental illnesses and the practices that support recovery. We have completed 4 webinars in this series, and we have 5 additional webinars coming up over the next couple of months. We will post registration links for these webinars in the chat box during the webinar. Recordings of the first 4 webinars are available on our website. We also wanted to ask that you complete the survey that you will receive via email following this webinar. We value this feedback and use it to improve our activities and inform future activities. The surveys are also important because our continued funding is linked to the completion of these surveys. So we thank you in advance for your feedback. We also want to let you know that this webinar is being recorded and will be posted to our website. Lastly, this webinar will be interactive. On your screen, you will have a taskbar with buttons that say Q&A and chat. Please use the Q&A feature to ask our presenter questions throughout the presentation. I will collect your questions as we go and ask them of the presenter during the Q&A time toward the end of the presentation. During the webinar, our presenter may pose questions to you. Please use the chat feature to answer these questions. There may also be some polling questions which will pop up on your screen where you can respond. Now let's begin our webinar. We're happy to have Jennifer Sperduter with us today to present on illness management and recovery. Jennifer Sperduter is a lecturer in the Department of Psychiatric Rehabilitation and Counseling Professions at Rutgers University. She has over 25 years of experience in the mental health field in a variety of community settings. Her current role is to provide technical assistance, consultation, and training to state psychiatric hospitals. Jennifer has been involved in the implementation of evidence-based practices, including illness management and recovery in a hospital setting. She has developed curricula for recovery-oriented programming to improve discharge readiness and facilitate community reintegration for persons served in the state hospital system. Recovery from serious mental illness has been studied and documented by researchers, practitioners, and individuals with lived experience around the world and across time. Recovery is real. Recovery can be supported by practices and services that encourage participant engagement, community inclusion, valued social roles, and overall wellness. This webinar series will introduce you to recovery from SMI, or serious mental illness, and many of the evidence-based and promising practices that support recovery.
Well, hi everybody, welcome. This is Jen Sperduto, and thank you, Katy, for the introduction. Today's webinar is going to introduce you to the Illness Management Recovery Program, or we call IMR, as one of those evidence-based practices which helps individuals develop the tools to manage their psychiatric illness, set meaningful goals, and make progress towards their recovery. So in today's webinar, we're going to define what recovery means and explore the relationship between illness management recovery and recovery. the core values of IMR, and what makes this program unique. We're going to look at the contents of IMR, review some strategies for IMR clinicians to run an effective group. Those are things like motivational strategies, educational strategies, and some cognitive behavioral strategies. So let's start by defining recovery. How do you define recovery? What does it mean to you? So take a minute before we get started, or as we're getting started, to think about what recovery means and identify one indicator of recovery. You can type them into the chat box. What do you think recovery means? So I'm going to give you a minute. You can type that into the chat box. Hopefully you can find that. So Daniel says, able to formulate a plan other than isolating. It's different for everyone. Management, reaching your fullest potential. Any others? In good health physically and mentally. Maintaining well-being, find a place in society. Recovery is the journey towards overall wellness. These are the answers that are coming in. Recovery means taking the steps necessary to start making positive changes, getting back to my quote unquote normal, moving towards wholeness, living your best life. Recovery from an illness or substance abuse, good question. It could be either, right? Recovery can be from a lot of things. Recovery to a stable mental health and emotional strength, ending behavior that harms a person and developing new good behaviors, living a productive life while managing illness, and a person having and feeling they have control over their life, and staying out of the hospital and maintaining, overcoming a struggle, living with purpose, acceptance, going to work again, even if it's a different job. So thank you all for those great responses. As you can see, there's a lot of different responses to what recovery means. It's a very individualized and very personal thing. So often when asked this question, people respond with answers such as being symptom-free, getting back to the way you were before the illness, being in control of your life, feeling happier, moving forward, achieving a better quality of life, and having good mental health again. And one of the responses that came in was, it's different for everybody. And that's exactly the case, right? It's a very individualized thing. So some of the responses that we normally get are things like being in control, having good mental health again, moving forward. Let's look at some other definitions of recovery. So one definition of recovery that's often cited is that by Patricia Deegan. Dr. Deegan is a clinical psychologist who is a professor at Dartmouth University, an advocate for disability rights, and a pioneer in the mental health recovery movement. She was also diagnosed with schizophrenia at age 17, and much of Dr. Deegan's work focuses on recovery and empowerment for people with a lived experience of a psychiatric illness. Her definition of recovery is that recovery is a process. It's a way of life, an attitude, a way of approaching the day's challenges. It's not a perfectly linear process. At times, our course is erratic and we falter, slide back, regroup, and start again. The need is to reestablish a new and valued sense of integrity and purpose within and beyond the limits of the disability. The inspiration is to live, work, and love in a community in which one makes a significant contribution. That's pretty powerful. Another definition is from the New Freedom Commission. As the recovery movement progressed, it became more and more apparent that services for people with mental illness and disabilities were very much fragmented. In 2002, President Bush unveiled the New Freedom Commission on Mental Health to address the problems in the current mental health delivery system and to increase educational and employment opportunities for people with disabilities, including adults experiencing mental illness. Their definition of recovery is recovery is the process in which people are able to live, work, learn, and participate fully in their communities. As we can see, recovery is very individualized and can have multiple definitions. And when we think about recovery, we tend to think of it as recovery from either a mental illness or recovery from substance abuse. And someone asked that question in the chat box, like, which one are you talking about? But the reality is we all have something that we've recovered from or from which we are in the process of recovering. Think about an event in your life, something major from which you've needed to recover. It could be an illness, it could be a loss of a relationship, of a loved one, a divorce, loss of a job, physical injury, or accident. Everybody has something. So think about that event in your life, and you certainly don't have to share, but what are the things that you needed during your recovery? What helped you in your recovery process? So we're going to start a poll. So let's see what people have to say about that. So some of the things that people normally can choose from are things like time, support, friendship, family, knowledge, hope, professional help, acceptance. I still have some votes coming in, and then I'll show you the results in a minute. Right now, support is in the lead. Let's see what else we have. All right, it looks like we might have gotten everybody voted. All right, so let's see what our results are. So support wins. Support wins with 78% of you voting for support. We have a close second with friendship, family, and time. So as many of those responses show, there are some really common elements to recovery. And if you look at the poll results, they're not too far off. Even the ones that came in 3rd, 4th, 5th, 6th, and 7th, they're all pretty close. So those are some common elements to recovery, despite the fact that people can be recovering from different types of life events. So let's take a look at that. So recovery should be individualized and person-centered, meaning one person's recovery journey doesn't look like another's. The supports that one person finds helpful in his or her recovery may not be the same for someone else. Recovery involves empowerment and self-direction and personal choice and the opportunity to try, to fail, and to grow from that. We say that recovery is not time limited. Time was our number 2 answer on the poll, but it's not time limited. Some people can recover from things in a shorter period of time, and other people need a lifetime to recover from something. So it's not time limited, nor is it a linear process. It's a process that doesn't always follow a straight path. Recovery is about making progress, having some setbacks or relapses, but continuing to move forward. Support, which is our winner, and these aren't in any particular order except how they fit on the slide the best. Support was our winner, and support is really an integral part of recovery and can come in many forms. Support can come from family and friends, professionals, and even peers. Having someone who has had the same or similar experiences can be a really powerful element to recovery. Another element of recovery that is holistic, that recovery is holistic, and it really embodies the whole person and different life domains rather than simply symptoms of an illness or trauma of that life event. Recovery builds on strength and what the person can do, and rather than what they can't. And finally, hope. Hope that things can and will get better, and that there's hope for the future. Hope is that quality that really motivates us to achieve goals and keep moving forward. Hope is that driving force that helps us persevere even when things seem really difficult. So one of the goals of illness management and recovery and this program is to inspire people to become hopeful about their recovery. We have to be hopeful for people when they don't have hope for themselves. In IMR, we strive to create and maintain an atmosphere of hope and optimism about one's recovery. So what is IMR? So IMR is, now that we've defined recovery, let's take a look at what the IMR program looks like and explore how recovery relates to illness management. So IMR is a very structured program that helps individuals with mental health conditions seek meaningful goals for themselves, acquire information and skills to develop more control over their psychiatric illness, and make progress towards their own personal recovery. IMR was originally designed to be conducted on a one-to-one basis, but many agencies and hospital settings choose to run the IMR program as a group just because it's more efficient. I just wanted to throw that out there in case that worked for you. So what are the goals of IMR? The goals of IMR are really to inspire people to become hopeful about their recovery. Like I said, you know, some people don't have that hopefulness for themselves. It's been a lifelong process of people being told that they can't do something because of their illness. But our role as facilitators of the program is to really inspire people to become hopeful and give them that hope back. The second goal is to prepare people to become informed decision makers about their own treatment. We believe in IMR that the person is the expert in them, not the treatment team or the family or the doctor, really helping people learn enough about their illness that they can make those decisions with their doctor and share that decision making. Third, IMR helps free people up to spend less time dealing with their illness and more time enjoying life. And lastly, we want to help people gain more sense of control over their mental illness. Knowledge is power, right? So we want people to have enough knowledge about their illness and what is helpful to them so that they can make good decisions about their own treatment. So let's talk about how illness management relates to recovery. So IMR focuses really on the individual setting personally meaningful goals and tracking one's progress towards achieving those goals. What's important to them? Again, not what the family wants or the treatment team wants. People are more motivated to do things when it's important to them. So IMR focuses on the individual setting goals for themselves. An improved ability to manage one's illness is a common recovery goal. We want individuals to be able to manage their psychiatric illness just as they would a physical illness, so that that illness is just one part of who they are and they're not defined by that. IMR is related to recovery in that the program provides individuals with knowledge, tools, and supports to manage their illness in a way that they can minimize relapses and avoid hospitalization. And obviously, less time spent being hospitalized means more time for pursuing personal goals and doing things that are important and meaningful to them. And finally, less stress from symptoms, from psychiatric symptoms, leads to a better quality of life. If you don't have to deal with focusing on symptoms and symptoms getting in the way of doing things that you enjoy, you're going to have a better quality of life. So there are some core values in the IMR program that all facilitators or people running the group should really subscribe to. And the first one is hope. Like we had mentioned earlier, hope is really essential and it's critical to recovery. As facilitators of the program, it is our job to be hopeful for people when they don't have hope for themselves. We need to provide hope that recovery isn't only possible, but that it's a reality for many people who experience psychiatric illness. The second core value of IMR is the idea of person orientation. People have strengths, talents, and interests, not just limitations and deficits and illness-related characteristics. We want to focus on the strengths and what people can do and not what they can't. We believe that everyone has the capacity to learn and grow and recover. And one way we do demonstrate this value is to focus on past successes and show people that they've done it before, show stories of success from other people, and allow the person to understand that they can do it. The next core value of IMR is self-determination. Persons with mental health conditions have a right to choose what goals in wellness and recovery are important to them and how they want to proceed in achieving those goals. Individuals should be empowered to make decisions regarding their own treatment and choices. Again, instead of just going by what the doctor says or the treatment team or the family, like the person themselves needs to have enough information about their illness so that they can make good decisions for themselves. So a provider or facilitator's role in IMR is to provide the information and support the person to make the informed choices for themselves. And finally, partnership. Partnership is really the spirit of IMR. Facilitators work side by side with the person in an equal relationship that demonstrates respect. Respect for the person, respect for their choices, and respect for their experiences. So what's so good about IMR? What makes it unique? What makes it different from other programs? So first, it's structure. The way the information is presented in a structured manner using a set agenda makes it easier for participants to learn the material. Second is its comprehensiveness. IMR covers a really wide variety of topics, such as recovery strategies, medication management, avoiding drugs and alcohol, developing social supports, coping skills, getting your needs met in the mental health system, along with relapse prevention and some strategies for living a healthy lifestyle. So next is its format. IMR is a manualized program. It comes in a book. And that it's a structured program in a manual that maximizes learning and accounts for a variety of different learning styles. The information is presented in various ways, using activities, checklists, discussion, role-playing, and skills practice to reinforce the material. We understand that people have different learning styles, and the format in which IMR is presented really speaks to a lot of those different learning styles. And people who are experiencing psychiatric symptoms may have some difficulty in learning as well. So this IMR takes into account some of those issues as well. IMR is based on the concept of recovery, like we've been talking about. Therefore, all of the content is really connected to one's personal recovery goal to make it relevant for them. IMR has an evidence-based foundation that we're going to discuss in a little bit more depth. What is an evidence-based practice? I'm going to back up. Anyone want to type in the chat box? Tell me what an evidence-based practice is. All right. I didn't get any responses, so I'm going to tell you. Evidence-based practices. Oh wait, should I go back? Practices that have been backed by evidence, like DBT, CBT, practice based on research and normed for a specific population, a practice that has documented positive outcomes, has been researched and validated. Perfect. Perfect. So evidence-based practices are services that have demonstrated their effectiveness in helping consumers to achieve important outcomes in several different research trials. So that means research trials were conducted by different people at different times and achieve similar outcomes. So IMR was actually developed as a combination of practices that had already had an evidence base. So these are the effective components of illness management programs. IMR, when it started, wasn't obviously its own evidence-based practice, but it was developed as a combination of all of these evidence-based components. So things like psychoeducation. Psychoed helps to improve consumers' knowledge about mental illness, but psychoed alone, however, isn't associated with improved outcomes. So the IMR program actually does include a lot of psychoeducation in every module, but it's not in and of itself a psychoed program. The next component of IMR is the behavioral tailoring for medication adherence. So this talks about developing strategies to simplify taking medication. It includes some strategies for incorporating meds into a daily routine, setting up cues or reminders in a particular environment, and helping develop a plan and practice a new routine. IMR also looks at relapse prevention training, which identifies triggers and early warning signs and what to do when warning signs happen, helping to develop a plan and an outcome. And relapse prevention training has been shown to reduce relapses and reduce hospitalizations. Coping skills training is another element or effective component of IMR, where it reduces the severity of persistent symptoms. Coping skills training reduces distress experienced from persistent symptoms. It looks at what the person's current coping skills are, what situations they struggle with, and amplifies current coping skills and teaching new skills and having the opportunity to practice. And finally, social skills training improves social functioning, including the quality and number of relationships, and improves skills that are related to achieving recovery goals. So since its inception, there has been additional research to test the effectiveness of this combination of evidence-based strategies, as well as the illness management recovery program. Studies of the IMR program since it started have found an increase in participants' knowledge of mental illness, their ability to cope with psychiatric symptoms, and an improvement in distress related to symptoms and hope and progress and goal achievement. One particular study that was done with IMR participants in a psychiatric hospital found that for every hour of IMR the individual attended at the hospital, there was a 1.1% less chance that they would return to the hospital. So it actually alluded to improving community tenure once the patient was discharged from the hospital. So IMR has that potential to increase community tenure after discharge. So let's take a look at the nuts and bolts of IMR and what the program looks like. So in general, and certainly this can be tweaked for your program or your setting, but we normally run the IMR group twice a week. Now remember in the beginning I said that IMR was developed to be done on a one-to-one basis, but a lot of agencies and hospital settings will do it in a group setting instead. You can reach more people, it's a little bit more time efficient and effective. So doing that at about twice a week, it takes about 6 months. I say about because it really just goes on based on the pace of your group. Some groups go a little more quickly, some groups take a little bit longer. It really depends on the makeup of your group. Normally we have about 6 to 8 people in a group, no more than 8. And in the IMR group, participants set these personal and meaningful goals, that's something that they want to work on. What is their recovery goal? And I know I've said it before, but not the families, not the treatment teams, not their friends. What does the person want? Because that's where the motivation comes from. Nobody wants to do something that they're not going to benefit from, or just because they're told to do it. So we really want to help people explore what personal goals are for themselves. In each session, participants practice skills in the IMR session, but they're also given an opportunity to get homework or practice assignments and practice outside of the group as well. We believe that if they just learn the material in the room and leave it there, it's going to stay there. So we want people to have the opportunity to really take it outside of the group or outside of the session and have an opportunity to practice that. And the practitioners or facilitators of IMR use motivational, educational, and cognitive behavioral techniques to actually run the group. And we'll go into those in a little bit more detail in a bit. And overall, in this manual, the IMR program manual, there are 11 educational modules or topic areas. So let's take a look at some of those in a minute. But first, I want to show you what the structure of the IMR session looks like. So for every session, it's going to have this agenda. So we start with some informal socializing, just to kind of set the welcoming tone for the group. Then we move on to reviewing information from the previous session. If you can get participants to help you review that, that's even better. Then you would review any homework or practice assignments that people had, follow up on some goals, any progress towards goals. If you have a group of 6 to 8, it might be difficult to do that for every single person each time. So you might pick 2 or 3 participants per session and then rotate. Then you would set the agenda for the current session, teach the new material from the handout or the manual, usually a few pages. I'll show you how it's broken down. And then develop a homework or a practice assignment with the participant. And then finally, just summarize the session and any progress that was made. So basically, you're welcoming people. Hey, remember what we did last session? Anyone do the homework? How are people working on their goals? What steps have you made this week? Today, we're going to talk about X. Then you would teach X. Here's your homework for X. And here's the summary from today. And summarize any practice. So basically, when I mentioned earlier about what makes this program unique, the structure is really one of them. And I found that participants really get used to this order and this agenda, and they expect that that's going to happen. And it kind of lowers the anxiety about being in a group when you know exactly how it's going to be done. So let's talk about the content of the IMR program. So like I said, there are 11 educational modules or educational handouts. They're broken down into clear topic areas within each module. So each module is a main topic. And then within that, it's broken out into 4, 5, 6, 7 different topics per module. The educational handouts are designed that there's built-in prompts for the facilitators for applying the information, discussion questions, doing role plays, checklists. There's lots of interactive type of activities and experiential learning that's built in. So as a facilitator, you have a lot of that prep work done for you. Not that you don't have to prep. I'm not letting you off the hook with that, but you do. You have to know what you're going to be talking about that day. You're going to have to kind of review some of the discussion questions, but everything is really right in front of you in this manual. There's home practice sheets for each handout topic. So that gives you ideas of what the home assignment or the practice assignment might be. And then finally, there's summary points throughout each handout. So instead of doing an entire module and then asking a participant, hey, what'd you learn today? There's summary points without, because that helps the person understand it better. It checks for understanding it, makes sure that the participants are learning as you go along instead of waiting till the end. There's things like, there's a facilitator guide also, a facilitator session guide that are directly matched for each topic. All right, so the first module is called Recovery Strategies. And this is really the most important, not the most important one, but it's the really important module in IMR, because this helps people define recovery, It increases their understanding of what recovery is, identify what helps their recovery, and looking at about identifying a personal recovery goal for themselves. And looking at the people, the places, and the things that can support them in developing that recovery goal and achieving it. So the reason I said the recovery strategies is so important is because this is where the participants set their very individualized, personally meaningful recovery goals for themselves. And the rest of the content in the manual is really connected to that recovery goal. When we talk about motivational strategies in a little bit, this is one of those things that's so important because, again, people don't want to do things that they're not invested in or they're not going to benefit from. So if we're talking about medication in Module 5, if we're relating it to the person's goal and connecting it to them, to their recovery goal so that it makes sense, that's different than saying you have to take your meds or you should take your meds or medication is important. If it's not important and related to their goal and connected in some way, it's not really going to make that, it's not going to really have the same importance level. So this module is really important in helping the person define what recovery means to them. And again, as we saw earlier, recovery can mean a lot of different things and it's very individualized and it can mean different things to different people. So really explore, this module really explores that with the people in the group. Module 2 talks about practical facts for mental illness. So this module examines the major psychiatric disorders such as schizophrenia, bipolar disorder, schizoaffective disorder, and also anxiety and depression. This module explores the symptoms and behaviors for each and identifies ways to manage those symptoms. So in this module, you also discuss stigma and people's experiences with stigma, and also how to deal with those negative attitudes and beliefs about mental illness that other people may have. Module 3 talks about the stress vulnerability model. So the stress vulnerability model emphasizes the important role that the following play in the development of psychiatric disorders and recovery. So things like biological vulnerability, stress, substance abuse, coping strategies, and the use of mental health services. So it really talks about, where does mental illness come from? It's not something that your mom did. It's not something you were, that someone did to you. It's not your fault. It talks about the neurobiological component of mental illness, what causes symptoms, what helps reduce symptoms or improve symptoms, like coping strategies and the use of services and how to avoid relapses. Module 4 talks about social support. So this module focuses on recognizing the importance of social support in recovery. Remember, support was our #1 answer in our poll and how important that is. And it provides some skills training on how to connect with others and form and maintain those closer relationships for support. So connecting with people, maybe having enjoyable conversations, how to share personal information without oversharing, understanding other people, and how to develop those closer connections. Module 5 talks about using medication effectively. And this module examines the role of medication in managing symptoms of an illness. It also discusses shared decision-making by identifying some helpful questions to ask about your medications. If you choose to take medication, how to get the best results. So what's one of the things that's unique about IMR is that we don't present the medication module by saying you have to take medications because your doctor told you to. We talk about the role of medication in managing your symptoms and managing your illness. We talk about identifying side effects, how to talk to your doctor about it, and how the medication that you're supposed to take actually helps you. And if it doesn't, how to talk to your doctor about getting the best results from your medication or changing your medication. So it's really about helping people learn enough about their medication and the role of medication in managing their illness in whether they're going to actually use it or not, so that they can make a best decision for themselves and not just take it because someone told them they have to. So it's a little bit of a different, for some people, this is a very different kind of approach. You know, we're used to, you know, people in a hospital are used to a doctor or their treatment team saying, you have to take your meds, you have to take your meds, you have to take your meds. And certainly we understand that a lot of relapses are caused by people getting out of the hospital and not taking their meds, and then they end up relapsing and coming back. However, it is a personal choice. The idea is to help the person understand the connection of how the medication is helping them. And similarly, with drug and alcohol use, this module identifies common reasons why people use drugs and alcohol. In this module, we discuss common challenges of sobriety and some strategies for coping with those challenges and developing a personal sobriety goal. And similarly to the medication module, we don't approach this module by saying, don't do it, or drugs and alcohol are bad for you. And certainly we understand that they can cause some issues, but it's, again, helping the person make the connection for themselves of why they would choose not to use drugs and alcohol. So understanding some of the problems that substances can cause, weighing the pros and cons of sobriety, identifying personal reasons for sobriety, which again could be like recovery, very, very different from someone else's reasons for sobriety, finding some new healthy options, new ways of getting your needs met, and developing a plan to stay sober should you choose that as your goal, as part of your goal. Module 7 is about reducing relapses. And this module helps participants identify those triggers of relapse and ways to recognize those early warning signs that are very individual for people. You know, what are those red flags that go up when someone's starting to get sick? When we're starting to get a cold, we have sniffles or a sore throat, or we're sneezing or coughing. And similarly, for a psychiatric relapse, there are certain red flags and early warning signs that people might have. For some, it might be not sleeping. For some, it might be pacing or talking quickly, or racing thoughts or hearing voices. What is it for that person? How do we help them recognize those early warning signs of relapse? Because research has shown that when someone is able to identify those early warning signs and get help before it gets bad, it will prevent a rehospitalization. Maybe all it takes is getting a medication adjustment or some additional support, rather than letting it get to the point where they need to be rehospitalized. So identifying the triggers of relapse, those early warning signs, and then developing a relapse prevention plan. Actually getting a plan in place when you're doing well and you're feeling well is really important, because when you start when a person starts to relapse, they might not be thinking clearly, like, what do I do now that I'm having these early warning signs? It's all in the plan. So then how to put your relapse prevention plan into practice. Module 8 focuses on coping with stress. So what causes it? Identifying the signs and symptoms of stress for you, for the person. Identify strategies for preventing and coping with stress, including the use of relaxation techniques. So this module looks at, like, what's stress look like for you? Do you get a headache? Do you get a stomach ache? What are the signs? How do you know that you're stressed? And then what do you do once you feel it? Where do you feel it? What are some actual techniques that you can use to deal with that stress? So a lot of this module looks at those relaxation techniques. It does guided imagery, progressive muscle relaxation. So things that you can actually do in the group that can that people can help practice, that people can practice with, and you can help them learn actually in the group. Deep breathing exercises, those kinds of things. And then finally, making a plan for preventing stress, because it's easier to prevent the fire than it is to put it out after it happens. But making a plan for preventing stress and then how to cope with it. Module 9 talks about coping with persistent symptoms. So this focuses on developing strategies for coping with symptoms such as anxiety, depression, hallucinations, sleep issues, low energy, concentration, anger problems. Participants in the group will develop a plan for using those coping strategies. Module 10 looks at getting your needs met in the mental health system. And this module provides an overview of community mental health services. It looks at financial benefits, health insurance benefits, and also provides some tools for advocating for yourself within the mental health system. And finally, the last module, number 11, explores what it means to live a healthy lifestyle. And it looks at the importance of a healthy diet, an exercise regime, personal hygiene, and some good sleep habits. And that's it. That's the content of IMR. So I think I always tell people when I'm training that I don't think the content is anything new for anybody who's worked in this field, but it's the way that it's all put together and the way that all of the content connects to the person's personal recovery goal. So it's the way that it's presented and connected to something that's meaningful for the person is what makes this a unique program. The content itself, I'm sure you've seen at least bits and pieces of it in other places somewhere, but all put together is this very comprehensive, manualized program that presents the information in a variety of different ways for the person to learn so that they can help connect it to their own goals. So let's talk about goals. We keep saying that we gotta have people set goals for themselves. So IMR is highly dependent upon the participant setting a recovery goal that's really individualized and personally meaningful. The content in each of the modules should be connected to that goal. The material comes to life really when the participant can make a relevant connection to how it applies to them and how it applies to them reaching their goal. So goals really should be individualized and focused on the person's goal. Again, not what someone else thinks they should do. Family, friends, treatment team, doctor. What do they want? Goals can range from modest to ambitious, and it's not our role as the facilitators to tell the participant that their goal is unrealistic. Rather, it's our job to understand the reasoning behind the ambitious goals and to help the person break it down into more manageable steps. Sometimes goal setting can be really difficult. We want to start by really exploring how the person would like their life to be different and what areas they would like to change. That's where the goal setting should happen. I'll give you a quick example. We were doing a group one time for an individual who was in the hospital setting, and he said, my goal is to be the president of the United States. So I thought, wow, that's a big goal. And there's only been, at that time, only 44 other people that have been president of the United States. So what is it about this goal that's so important for this gentleman? And so after really exploring it and uncovering all the different layers, it turned out, so I'll tell you a little bit about the process. I said, well, what do you need to be the president? And he would say, well, you got to be 35 years old and you have to have a high school diploma or a GED. You have to have good people skills. You have to want to travel, or at least not want to, but you have to travel. So then I'm oversimplifying this example for the sake of the webinar, but then I asked this individual, how would your life be better if you were the president? And he said, well, I'd get to live in a big white house. I'd have my own plane. I'd have money. I'd get to travel. I'd meet a lot of people. I'd have respect, and I'd have power. And, you know, he went on to list all of the benefits that he saw as being president. And what it came down to really was that he wanted to go back to work, and he wanted to be in a position that he felt like people respected him. So to him, the president is who epitomized respect in his mind. So when he said his goal was to be president of the United States, that really wasn't it at all. So had I gone in and said, oh, well, that's silly and that's unrealistic, it would have really shot it down and made him just shut down. Like, he wouldn't have kept on exploring what that really meant to him. So when someone does set those ambitious goals, it's our job to help kind of, you know, peel back the layers and figure out what that really means, because it may not mean exactly what they say. So when we're doing goal setting, we want to acknowledge that people may have had negative experiences previously in goal setting. The word goal, or what's your goal, can really kind of feel overwhelming for some participants. So maybe try to use phrases like, what changes would you like to make? Or what are some things in your life that you'd like to be different? Or what are some things that you want to do? Right? So rephrase it so it's not like, what is your life goal? Because I know if someone asked me that question, it would feel pretty overwhelming to me. And some areas of your life you want to make changes, and some you don't. So it's helping the person explore which areas of their life that they'd like to make changes in. Breaking large goals into short-term goals and manageable steps that are achievable. Participants will be much more motivated by small successes and achievements rather than a failure to reach a big goal. So we want to help them break those big goals down into more manageable steps. And part of the goal setting process and in IMR sessions is to follow up on the goal regularly. Maybe it's not the goal that's not achievable, but maybe the steps might need to be revised. We want to check on progress towards goals regularly, either like weekly or every few sessions, reinforce any steps that were taken, help the person problem solve any obstacles for taking steps. And to maintain enthusiasm, we really want to help remind participants how those small goals are related to the larger ones, and look at those small successes and achievements. It's really helpful when someone's working on their goal to involve significant others whenever possible for support. I know in my experience implementing the IMR program at the hospital, it's been really difficult to do that part, but research on IMR has shown to be more effective when participants are able to involve their significant others for support. And if the participant is lacking hope or self-efficacy, it's really important to help them build up that hope and confidence. So how do we actually do the group? So IMR uses a combination of strategies to actually facilitate the group. So clinicians use a combination of motivational, educational, and cognitive behavioral strategies. And we're going to take a look at each one of those to see what that might look like. So the first is motivation. Motivation really addresses the question of why the person wants to learn, why the person wants to recover, what's the goal, and what's in it for me. Again, I think I've said it a few times, but nobody wants to do something that they don't want to do. Nobody wants to do something unless they understand what benefit it has for them. We go to work, we all maybe love our jobs, but we do want a paycheck at the end of the week, right? So there's some motivation there. So we have to figure out what that motivation is for the participants in the group. So a lot of the motivational strategies that we use is to help people get motivated to learn. People are motivated to learn things if they are relevant to personal goals. If a person doesn't view learning certain information or skills as relevant to his or her needs, they will not be motivated to invest the effort to learn. And I'm going to make that red because it's really important. I've said it at least 6 times today. But if a person doesn't view learning information or skills as relevant to their needs, they will not be motivated to invest the effort to learn. I think that goes for all of us, right? So helping the participants make that connection of the why is really critical. So let's take a look at some motivational strategies that we use in the IMR group. The first is connecting the IMR materials to the person's goal. Again, make it relevant. Secondly, we want to explore barriers, fears, and lack of confidence that the person may have in moving forward. Like what stopped them from reaching their recovery goals in the past? How do we overcome some of those barriers? And how do we provide hope and confidence in the person? Thirdly, we want to help the person explore the pros and cons of change. That's a very common motivational strategies. Like, how would your life be better if you reach this goal? How would your life be better if you quit smoking? How would your life be worse if you quit smoking? What are the pros and cons to the person? Again, we have to kind of keep ourselves out of it because it's really easy to kind of put our own opinions in there, but it's not about our opinions. It's about helping the person explore the risks and benefits of changing for them. Next is reframing experiences in a positive light. So when people have had to deal with an illness and stigma for many years of their life, they tend to have, they tend to internalize some of those negative attitudes and beliefs. So it's important as the facilitators to kind of reframe some of those experiences in a more positive way. Sharing stories about recovery, having guest speakers come in and share stories about recovery, like, hey, they could do it, so can you. That could be a really powerful experience, and I would encourage that a lot. If you're able to get someone to come into your group and share stories about recovery, or at least, see a video or, a list of people, famous people who have had mental illnesses or had experience with psychiatric illness, and look at their recovery stories. That could be a really powerful strategy to use. And then finally, conveying hope, and confidence in the person that they can do it, right? So motivation is about the belief that somebody can do it and helping them make that connection for themselves. One of the motivational techniques that we use, this is from motivational interviewing actually, is using open-ended questions. So we use a technique called OARS, which is open-ended questions, affirmations, reflective listening, and summarizing. So open-ended questions are simply just questions that keep people talking, keeping them engaged in the process, getting the participant to do more of the talking, exploring options. Don't ask yes or no questions, right? We want to ask open-ended questions that get the person to answer and keep going. Affirmations are simply statements of recognition about client strengths, supports the ideas that the participants can succeed and that change is possible. These are really relationship builders. It reduces the negativity. Those affirmations, though, have to be consistent with your feelings and really have to be sincere, because people know when you're not being sincere. So an example of an affirmation might be something like, wow, you are really able to stay calm. Frank tried to get under your skin. Or you're a really patient person. Or, hey, you took a shower today. That's great. I know that's how hard that is when you're depressed. That's an affirmation. Reflective listening is simply making statements back to the participant about what your view of what they're saying. So it's kind of checking, understanding, not parroting, but just kind of paraphrasing back to the person that lets you know that you've understood. And then summarizing. So we see the OARS, open-ended questions, affirmations, reflective listening, and summarizing. Summarizing is a type of reflective listening. So reflecting back on what the participant has been saying, kind of putting the attention on the important points. So the most powerful motivational strategy is helping people progress towards their goals. So these all help in getting you there. The second type of strategy that the facilitators in IMR use are educational strategies. And educational strategies are used to provide the information that individuals can use to learn how to manage their illness and reach their goals. So the way we present the information is very strategic as well. As I mentioned, the IMR manual is broken down into different topics. There's built-in prompts, there's discussion questions. That's all very purposeful. So the IMR group is really about interactive learning. People learn best by hearing, seeing, doing, discussing. It really brings the information to life. If we just have somebody read something, there might be a small percentage of a chance that they'll remember it. If they read it and see it and write it, a little bit better. If they read it, hear it, see it, write it, talk about it, a little bit better. And if they see it, read it, hear it, write it, discuss it, and then actually practice it, it increases their chance of learning and retaining the information much better. So we do a tell, show, do, discuss model for presenting IMR. So the IMR group has this interactive thing. Everyone has a different learning style. So we really want to accommodate for that by telling, by providing the information, showing an example. So the facilitator would demonstrate, doing a learning activity or exercise, and then discussing all the way through. So discussing throughout. So we want to tell, show, try it out, and talk about it. So all these different learning modalities come into play and tries to account for some of the variety of different learning styles that people have. So some of the educational strategies that we use are simply orienting the person to the group, orienting the group or the person to the lesson. So here's what we're doing today. You know, think about someone coming into a group that you've run in the past, and they might be coming from a phone call or from lunch or from wherever they're coming from. So we want to, when we look back at that structure or the agenda for IMR, that's part of this strategy. That's very purposeful. So that first step of the agenda is informal socializing and reviewing the information from the last session and setting today's agenda, right? There's a purpose for that. So orienting the person to the group, reviewing the previous session, as I just mentioned, and then using those handouts in interactive ways. So in the group, we normally ask participants to participate in reading, take turns reading. If you as the facilitator are doing all the talking and all the work, you're not doing it right. So we really want to help engage people by asking them to read. Certainly they can take a pass and not do it if they choose to or choose not to, but we want to make that offer and get people involved in that way. We want to check for understanding. You know, instead of reading a big page of content, we would want to read a paragraph and then perhaps ask the person to put it into their words. Hey, what did we just talk about? You know, this paragraph talked about coping strategies. What are some things that you heard? You know, check for understanding, because you want to check as you go along. You don't want to wait till the end and then someone says, I don't know what we just talked about. So you want to frequently check for understanding. Use chunking to break down the information. Again, you don't want to read a whole page. You might want to read a paragraph. You might want to read a section. And the way that the manual is designed, it's really easy to chunk that information because I don't remember what I read after a whole page. We can't expect everyone to do that. So we need to use this chunking strategy to break down that information. Again, sharing stories of success and wellness and hearing stories of other people's recovery can be very motivating. Another educational strategy that we use is to coach people to try new strategies. So providing the demonstration, telling them how to do it, and providing a safe place for them to try that. Using yourself in the role plays and demonstrations, so they can see it first. It's really can be kind of anxiety provoking to be in a group and someone says, okay, try to use this skill or try to practice that without ever having seen it done. So we want to use ourselves in the role plays and demonstrations. And finally, summarizing. So orienting the person to the group, telling them what you're going to tell them, and then at the end, tell them what you told them. So repetition is not a bad thing. So we want to make sure that people understand by summarizing. And the final set of strategies are cognitive behavioral strategies. So things like the cognitive behavioral model says that it looks at the combination of, or the between thoughts, emotions, and behaviors. So what we think affects how we act and feel. And what we feel affects how we think and do. And what we do affects how we think and feel. So the cognitive behavioral strategies that we use will help to create some more positive thoughts and helpful behaviors, and we'll go through that. But an example of the cognitive behavioral model are things like, say you have the thought, I can't connect with anybody, I'm always going to be alone. Your feelings might be sadness or loneliness or being angry at yourself, which could lead to what you do, which is isolating or watching TV or overeating or using substances, which then makes you feel, I can't connect with anybody, I'll always be alone. And it could go in all of those directions. So what we think affects how we feel and act, what we feel affects how we think and do, and what we do affects how we think and feel. So some of the cognitive behavioral strategies that we use in IMR, the first one is reinforcement. Reinforcement just helps build the person's self-efficacy and the belief that they can do it and the confidence and enthusiasm to do something in a more positive way. The second cognitive behavioral strategy is called shaping. And shaping really uses these successive approximations. So reinforcement is given for getting progressively closer and closer to this target behavior. So small steps. Modeling is simply demonstrating skills, setting the example, showing people how to do something. Cognitive restructuring is identifying and changing those automatic thoughts by disputing them. That processing style can come from negative events, stigma, symptoms. I like to look at cognitive restructuring as like if you've ever seen an old record player, you know how records have those, albums have those grooves on them? And when we're used to those patterns of automatic thoughts because of our symptoms, because of stigma, because of negative events, anything that happens, we automatically get back in one of those grooves. So cognitive restructuring is about how do we reframe and consider alternate explanations to those events and get ourselves out of those already grooved in pathways. And finally, practice. Practice is just the repetitive use of skills in a safe environment like the group that will help them learn the skills, learn the information, incorporate it into their daily routine or repertoire, and it's things that will help them be successful. And practice is so important that we assign a practice assignment or homework. No one likes to call it homework. No one likes homework. So we call them practice assignments, and practice assignments are developed between the facilitator and the group or the individual collaboratively. These practice assignments either focus on what you did in group to reinforce what you learned. It might be trying a skill that you talked about that day. Everyone in the group could actually have different practice assignments. It could be something related to their goal. So it could be related to the information that you learned that day. It could be related to the person's goal. You want to review practice assignments on the next session, focus on any small improvements, and then we call it praise, polish, praise, right? Do you want to praise them for actually doing it, polish it, or problem solve any issues that they had, and then praise again for the effort that they made. So practice assignments really are very important. They help the participants transfer the information that they learn in the group into their daily lives. So the real therapy is what happens outside of the session, right? Again, if people learn what they need to learn in the group and it stays there, then it's staying there. It's like learning in a vacuum. So we want to make sure that the practice assignments are developed collaboratively at the end of each session, that you're as specific as possible, and that people have the supports to actually do those assignments and learn the skills or practice the skills that they're learning in the group. So in summary, IMR is the structured program that helps individuals with psychiatric conditions seek meaningful goals for themselves, acquire the information, skills to develop more control over their psychiatric illness, and make progress towards their own personal recovery. And as we just learned, the IMR clinicians use a combination of motivational, educational, and cognitive behavioral techniques to facilitate the group. So I just want to throw this in here before we get to the Q&A, that the point of recovery isn't to live without the ups and downs, it's learning how to live with the ups and downs, because they're going to come. Recovery isn't a straight line from point A to point B. It's going to have ups and downs, but how do we manage those ups and downs? How do we manage to keep moving forward even when we have the ups and downs? So I'm going to turn it back over to Kadi, but thank you, everyone.
Hi, everyone. So thank you for joining us. And at this time, we'd like to open either the chat or the Q&A section for any questions that you have. I have been writing down and taking notes of the questions that were posed earlier. So we'll begin with those. So Jennifer, Ruth asks, what is the name of the study that supports IMR? I'm sure once we have that information, we'll be able to email it to our participants, but she was wondering what's the name.
So you'll get a copy of these slides that we used in today's presentation, and if you look on the first reference slide, the second entry, Bartholomew and Zechner, 2014, that there are plenty of research articles about the effectiveness in IMR, but this article in particular was the one that talked about IMR being helpful for increasing community tenure. So that's the one that showed that for every hour of IMR that a person received in the hospital, they had a 1.1% less chance of returning to the hospital.
Thank you. And we will include a copy of our presenter slides in addition to your certificate and a link to the survey in an email that I will be sending out after the webinar today. And then Vanessa asks, where does she get the IMR materials?
Okay, I'm going to direct your attention to the second. Oh God, where is it? I'm going to go back. I'm going to make it a very easy answer, Vanessa. You go to the SAMHSA website, and there's a free, all of this, the IMR information is public domain. So you can access the entire manual. The manual that I use was actually the third edition manual from Dartmouth and Hazleton, but the information that the SAMHSA website has available is absolutely accessible to everybody. You would just look under Illness Management Recovery Toolkit or Google SAMHSA Illness Management Recovery, and it's there. I really thought I had a link to it in here, but.
And we will be sending that link in the email following this training. I will be sending out a link to all of the resources that Jennifer has discussed. And Amber asked if there's a certificate or a certification that is required, or does a person need a certain amount of CEUs to provide this training or the IMR program?
There's no certificate or certification that I know of, Amber. And I know that different facilities require different amounts of training. I believe the training I got a long time ago was a 2 full-day training that was done by the developers of IMR, which was Kim Muser and Susan Gingrich. But other places do a half-day training. I mean, what I gave you today was an overview. It was an hour and 15 minutes. So there's certainly a lot more detailed information to go through. If you want more information, certainly look at the SAMHSA website for illness management recovery. But the training really does vary by facility. But you don't need a specific degree. You don't need to have to be from a particular discipline in order to run this group. What you need to run this group is the hope and the enthusiasm, and to be able to present the IMR program in a hopeful way. That, I think, is more important than any degree or particular discipline or certification that you can have.
Thank you. I think you touched upon an important topic, which is how to advertise the IMR groups and programs and the curriculum, and advertising as hopeful. It will definitely help increase their motivation.
Yeah, when at the state hospital, when we would recruit participants for the groups, we would go around to their community meetings and say, what are some goals that you want to work on? And what are some things that are important to you? And I can't tell you how many people said to me, I've never been asked that question before. And so just the fact that somebody was interested in something that was meaningful to them was a motivator for them to join the group. So, there's lots of information in the actual manual about how to present this to participants or potential participants. But for me, I found that what was really most effective in getting people to want to come to this group, there has to be that intrinsic motivation. It wasn't about the coffee or the donuts being served at the group, because I won't do it. But it's about, like, how is this group going to help me? And why should I come to a group? Because it's about you. We present it in a way that's, hey, this is about what you want, not what I want, not what your family or treatment team or doctor. And that's not to diss any of the treatment team members or doctors or family members, but it's about saying, the way people are going to motivate to change is by doing something that's important to them, because it's going to benefit them in some way. So we want to help people make those connections and work on the things that are meaningful to them.
Thank you, Jen. And then we have a question by Kyle. Do you have any resources for how peer support specialists can use IMR with clients?
I don't have any specific peer support resources, but I think this is an amazing thing to do in a peer relationship. If you're looking to kind of get that peer connection going, this is a great resource to have, because it can really help structure your interactions with the person that you're providing services with. But again, if you look on the SAMHSA website, I don't think there's anything peer specific, but I don't think that would exclude peers from providing this this intervention.
Thank you. I don't see any other questions posted in the chat box. We have maybe 1 or 2 minutes left. So if you have any other questions, oh yes, we do. We have one from Susan. How long do the groups typically take?
We do about 45 minutes to an hour. It really depends on your facility, your agency, what their normal group structure is. I think 30 minutes is too little. I think an hour is too much because people get to a saturation point. I think 45 to 50 minutes is really the perfect middle ground because you get enough time to get people engaged and enough time to practice and review the material, but not too much time where they're getting bored and losing interest.
Thank you. And then we have a question by Rohini. While IMR recognizes that there are different pathways to recovery, how does IMR address differing views in medication management and recovering from mental illness? What if people choose other paths instead of medication management?
So again, the medication management or the medication module is really presented with the approach of, I'm not saying you have to take medication. I'm trying to help the person make the connection between how their medication might help them and how the medication might help them by reaching their goals. If somebody wants to go back to work and they know that, concentration might be a big factor for them, but when they take their medication, they're able to concentrate a little bit better. So helping them make that connection. Well, if you're able to concentrate better, you might be more effective in your job. You might be able to do your job better. So therefore, it might lead them to, make that connection of, oh, I should probably take my medication in order to reach my goal of getting back to work. It's not our place as facilitators used to say that you have to take your meds. It's helping the person make that connection for themselves. We want to see light bulbs go off, right? We don't want to just tell people what to do. We want to see light bulbs going off and that they make that like, yeah, that's it. That's going to help me. There was an example that happened in my group where this one gentleman said that his recovery goal was that he wanted to have a relationship. He wanted to find someone, he wanted a girlfriend. He really actually, once we kind of peeled back those layers and got more out of him, his goal was to have like a companion. It wasn't necessarily a girlfriend or, in an intimate way, but it was more about like, I want a friend, and he wanted someone to go to the dances with, and he wanted someone to sit with and, sit with at the movies and in the hospital. But part of his, some of the factors that prevented him from doing that was his hygiene. But if the staff told him, hey, John, you need to take a shower, or John, you don't smell that great, John didn't really care about that. But when we helped him see that, hey, if you're going to try to meet a girlfriend, do you think the ladies might like you to smell nice? Do you think they supposed to be clean? And so on and so on. And for him, that was that light bulb moment. It connected. So if the staff said, take a shower, your clothes are dirty, or take a shower, you don't smell very good, that didn't matter. That wasn't what it for him was. Once he was able to make the connection with how does it help me get a step closer to my goal, that was the light bulb for him. In his question, it really is a very personal choice. And if someone chooses not to, that's their choice. We just want to make sure that they have all of the information that they need to make the best decision possible themselves. We can't force medication on somebody. I mean, I do consulting medication in a state psychiatric hospital. I see medication as a huge issue. The staff there don't necessarily see that as a choice. People can refuse to take the medication in a hospital, but pretty much it's a medical model setting. People are told that they have to take their meds. So when we come in with the approach of it's your choice, you just have to make an informed one, the participants are like, what? Like that's all brand new information for them. So it's a very different approach, but it's about helping Dr. You know, that doesn't really sit well with me, or I had a bad reaction to that one time and I'd rather not take that one. Is there something else that we can choose instead? Yeah, that's a normal conversation that we can have with our medical providers. I think, you know, people who have lived with a psychiatric illness for, you know, a large part of their lives have gotten used to the medical professional telling them what to do without feeling like they have the right to advocate for themselves.
Thank you, Jennifer. And then we have a question by Tim. How long has the IMR strategy been in existence, and how was the 1.1% followed? And over the years, how is it being actually effective on people? Is it used today in counseling sessions?
I don't know about private counseling. The 1.1 by Bartholomew and Zechner in 2014, that was a study that was done with patients who were at a state psychiatric hospital in New Jersey. And so they were able to monitor the dose of IMR that each participant received. So they could say they went to, you know, over a year, they went to 52 sessions, call it, you know, if they went once a week, or maybe even more if they went twice a week. And then they followed once that person got discharged, they looked at data of them in the community and when they returned to the psychiatric hospital and how long that was, and then compared the length of their community stay to the amount or the dosage of IMR that they received while they were at the hospital.
Thank you. And then our last question that we have is by Michael. Do the different topics order matter in IMR delivery?
So great question. So I would say no, it doesn't matter. What does matter is that you do the first one first. So because that's where the goal setting takes place, and because all of the rest of the content is related and connected to the person's recovery goal, we want to do that one first. We have to have the goal as a starting point, right? So once you do that, you can really jump around if you need to. I've had groups that, you know, we did module 1, but then they really, you know, maybe, you know, a certain makeup of the group or certain participants in the group really wanted to focus on social support. We would jump to that one and we would do that module because that's where the relevance was. Or if I knew that I had people getting discharged from the hospital soon, we might go to the relapse prevention, the relapse prevention strategies module number 7 and work on developing individual relapse prevention plans for everyone. Or, you know, or then when we got to, I usually do 1 and 2 first, just because I think it's important for them to understand the practical facts about mental illness and where it comes from, what the symptoms and behaviors look like. And then I can jump around, but you have to do number 1 first, and then it's kind of up to you and up to your group. And often I would let the group decide where we wanted to go next. Let's take a vote. Do we want to do social support? Do we want to talk about coping strategies, or, you know, coping with symptoms, or stress management? Where do you want to go?
Thank you, Jennifer. And again, thank you for joining us today for our webinar on illness management and recovery. As I mentioned before, I will be emailing everyone our presenter slides in addition to the link to the SAMHSA IMR toolkit, and then a link to our evaluation survey. In the email, we will also contain links to our upcoming webinars that we hope you can join us. And as well as if we missed any question, or if a question comes up after the webinar, we'll also provide Jennifer's contact information, which is also in her slides. So thank you again, and we hope you enjoy the rest of your day.